All right, guys, we're back with Dr. Kevin Connors. And this bio was truly exciting to me because the work is so in line with what we do. And I'm excited to talk to him today and dive a little deeper. Dr. Connors is a clinical director at Connors Clinic, an alternative cancer treatment center. He graduated with his doctorate from Northwestern Health Sciences University in 1986. He's been studying alternative cancer care for over 23 years. He holds AMA fellowships, board certifications in anti-aging medicine, regenerative and functional medicine, botanical medicine, and is board certified in integrative cancer therapy. So his perspective is truly unique. Dr. Connors is also certified in functional neurology. He has over 300 hours postgraduate study in autism spectrum disorders, which we'd also like to touch on today. He's trained and certified in epigenetic clinical methylation and nutrigenomics. Dr. Connors is practicing applied kinesiologist with an emphasis on botanical medicine and homeopathy. He has written numerous books, and I'm going to tell you something amazing about those books, including Stop Fighting Cancer, Start Treating the Cause, The 7 Phases of Detoxification. And the amazing thing is he's actually made them available for free. So you can go to connorsclinic.com/books. It's his gift back to the world. He wants you to have access to the information and download them all for free. Welcome today. Thank you for joining us.
Thank you. Good to be here. Fantastic.
So first of all, just reading what you do and the scope of your experience and knowledge, like sincerely, I'm excited to talk to you because we hardly get to meet people that have sort of both sides of the story and are trying to find that middle ground and truly care for people. And you've been doing this for 23 years now.
Yeah, I actually been doing it for longer than that, mainly focused on cancer for the last 23 years. But yeah, we've added nutrigenomics, looking at people's DNA, I don't know, 7 or 8 years ago or whatever, when it first started coming out, because it's just, whenever you hear about a new piece of the puzzle that you can help understand why a person might be going through something and that you could make alterations to their progress, it's always a blessing. So,
and you've been out there touting that, you know, your genetics aren't your destiny, meaning that although you get pointed in certain directions, you kind of understand what to work on, where to focus, but there's so much more is what you learn. And I think what you're talking about, correct me if I'm wrong, is the genetic conditions that people are focused on. You know, like you're born with this switch that needs to be turned on or off that may equal a cancer, but most cancers aren't that, right? Is that correct?
Yeah.
So most cancers.
I mean, there's really very little genetic connection directly to cancer. I mean, there's people with what's called Lynch syndrome, which is a specific gene that's going to predispose them to colon cancer. But that's rare.
Right.
Even, you know, among people with colon cancer, a very, very small population, it's because of Lynch syndrome. So there, from a cancer and genetic perspective, really, I think less than 5% of the cancers have a direct genetic component. You don't get cancer because of your genes. It's that indirect piece that if you look at some different metabolic pathways in the genetic spectrum, you can help prevent all sorts of diseases if you know what's going on. It's kind of like you talked about with, you know, having free access to all our books. It's our gift to the world to spread knowledge. And it just sparked a thought in my mind is that that's really it. The more you can know about your body and about what's going on from a metabolic standpoint with all your cells, and the more you can make changes consciously that can alter the outcomes. And that's the whole idea.
And the thinking, unfortunately, is that, you know, my mother had breast cancer. It's in my genes. It's in my genetics, right? There may be things going on genetically that make you at higher risk for certain exposures to cause that inflammatory or metabolic load. And that's actually the thing you need to understand and deal with. But it doesn't directly equal cancer. Cancer is that happens to be the spoke that got triggered for you. For somebody else, it could have been something else, depending on where cellularly they're sort of underwhelmed, right? So is that where you dove into sort of the nutrigenomics to try and understand what are those environment, nutrition, lifestyle factors? What are those loads that equal the net disease?
Right. That's really it, because it is those secondary things, tertiary things. So if I have, for instance, if I have a lot of defects on my cytochrome P450 pathways, my liver phase 1 detoxification pathways, I'm going to have, by that, quite possibly a slower liver detox pathway. So let's say if you and I are both exposed, living a very similar lifestyle, both exposed to the exact same number of toxins, let's say,
Mhm.
if that was even measurable, but let's say we were both exposed to the same lifestyle, but you have really healthy liver detox pathway genes. So you make, an adequate amount of enzymes for your phase 1, phase 2 liver detoxification pathway. Your liver is going to be functioning very healthy, and you'll be able to process toxins faster than if I had a lot of defects on those pathways. So if I have a lot of SNP defects on my cytochrome P450 or my PON1 pathways, my liver is going to be able to process toxins slower than someone who doesn't. And that's the idea. I mean, you can't give a one-to-one correlation to what that's going to do to a person's body, but if we're exposed to the same amount of poisons, I may not get rid of them as fast as someone who doesn't have those pathway defects. And if you knew about that prior to, being, end up with a diagnosis of a serious disease, you could make some alterations in your lifestyle, or it may scare you straight and be careful with toxic exposure that can help prevent a serious diagnosis in the future.
So there's some people that ask then, okay, I understand that my liver it's a little suboptimal, doesn't work as well as my friend or cousin or whoever. Why is the net result of that potentially cancer? What's that bridge? What actually happens biochemistry wise where that toxic load leads to this cellular change and I have cancer?
Well, the physiology is simple. So if I'm exposed to poisons, whether I breathe them in, whether I ingest them or inject them, or put them on my skin and absorb them, those toxins get into my bloodstream. If you can think of it kind of like a cartoon, this is how my brain works. These toxins are circulating around in your bloodstream and they get to the liver, and the liver will either say, yep, come on in, we can process you and get you out of the body. Or if your liver is full from a genetic issue, full from being overexposed to toxins, full from a lifestyle of alcohol abuse or other dietary abuse, then that liver says, hey, we can't take you, no vacancy. That toxin circulates around the blood again, asks again, knocking on the door of the liver again. Next time it goes around, still full, circulates around again. It's going to be shunted to the extracellular spaces. You're not going to just have a toxic load in your bloodstream. I mean, it's going to damage red blood cells. It's going to damage endothelial cells, causing heart disease, cardiovascular disorders. And actually, that's one of the causes of that. But it's going to be ultimately shunted to your extracellular spaces and then can cross your cell membranes into your cells. And that's when it can really do damage. So any sort of toxin, whether it's a heavy metal or glyphosate or some other pesticide or herbicide or anything, if it gets inside the cell, it can affect cellular function. You have all these different little organelles in the cell that do very specific functions. It's like literally as busy as New York City inside every single cell of your body. If it affects the DNA, it can affect the replication cycle. So normally, most of your cells have a replication cycle of anywhere between 8 to 24 weeks, meaning that, let's say your liver cell is going to reproduce another liver cell in 12 weeks, and then that mother cell will die through a process called apoptosis. And that cycle continues. You get a renewed body constantly, and it can renew slightly degenerate. That's what aging is. And you could do some things to help hinder that. But if something gets inside the cell and affects the nucleus and increases that rate of replication, that's really what cancer is. So the definition of cancer is one of your cells, it's not an outside thing, one of your cells, something is affecting that rate of replication, and now it's in a state of rapid replication. That's what cancer is. And it's replicating cells that are in a state of rapid replication. So how fast that rate of replication is, whether it's once a day instead of every 12 weeks or multiple times a day, is how aggressive the cancer is. So toxins are a major piece to that. Toxins, anything that gets inside the cell can affect the DNA. It can be a biotoxin like a bacteria or a virus, but certainly more common than not, it's a toxin that affects the DNA. So that's why toxic exposure can overwhelm your liver. Toxic exposure that doesn't get out of your body becomes a part of your body. So anything you're exposed to that you can't get rid of becomes a part of you. And it doesn't mean it's going to cause cancer every time, but you increase your risk of a serious disease like that if you don't get rid of it.
Right. And this is where there's a lot of, so we deal with a lot of particularly breast cancer patients where the sort of light bulb that went off is, I now know why. It's not so much about what, like I have cancer and how do I treat it? That acute response, let's correct it, right? But if you don't know why it happened, you're literally going to correct it to walk back into the exact same lifestyle, environment, load, toxic load, whatever it is you were doing, and then wonder why did it come back, right? So that question, that why question, although we're kind of in that process, it's not really answered, and we're not even looking for that answer. That really is the cure, that why.
It really is. I mean, you at least have to address it. You could do chemotherapy and radiation and standards of care, and it could knock you down to no evidence of disease. But if you don't deal with the cause,
Right.
The chance, I don't want to say it's always going to come back, but the chance that you have reoccurrence, either metastasis or another separate primary cancer, the risk is there. So if you can mitigate that risk any way possible, you're just going to have a better outcome.
Now, when you're dealing with cancer patients, when things have progressed, into stage 3, stage 4, how much is this type of work actually effective? Like, is this something that can only be helpful at an early stage, or are there things you can do for that stage 4 patient that maybe they wouldn't normally have experienced at the typical allopathic level?
Yeah, most of the things we're talking about here are not being addressed at all at the allopathic level. Matter of fact, you get a cancer patient, it's not uncommon that they'll do a genetic profile on them, and patients think that they got a full genetic profile, but really they only did 12 of their BRCA genes or something like that.
Yeah.
So they didn't get a genetic profile. So when we look at a person's genes, we're not just looking at tumor suppressor genes. So your BRCA genes are tumor suppressor genes. And yes, if you have defects in specific BRCA genes, it's going to increase your risk of a hormone type cancer like breast cancer, ovarian cancer, or something like that.
Right.
However, you can't change those genes. You can do some things if you do know that you have those defects to help mitigate your risk somewhat, but that's not really what we're looking at. We do look at the tumor suppressor genes, and more than just the BRCA genes. There's multiple tumor suppressor genes because there's ways to stimulate those even if you have defects. But you have to look at these other pathways, and we'll just use the detoxification pathway as an example because we look at multiple metabolic pathways with people's genes. But the detoxification pathway may be one of the most important because even though I have a defect in a tumor suppressor gene, let's say I have BRCA gene defects, doesn't mean that doesn't cause cancer. So your tumor suppressor genes are genes that turn on specific apoptotic cycles, meaning that if a cell goes in rapid replication, you have these genes in your cells that will turn on these tumor suppressor genes to cause the cell to die. It will cause the cell to die if it goes in rapid replication. If I have defects in the BRCA genes, it's going to be less apt to die, but still that didn't cause the replication. Something else still got inside the cell and damaged the DNA and caused the rapid replication. It was, if I have BRCA gene defects, then I'm not turning on a cell apoptotic process that's killing it, but it's that defect is not causing the cancer. So just be straight. We would keep our listeners understanding that piece. However, if so, again, then you get back to what the cause is. So is it a toxin? Is it a biotoxin? What is it that got inside that cell and is causing that? If it is a toxin, your toxins detoxify through your liver detox pathways. You have to make sure that those are open genetically and functionally. So it's not just your genes. You can have very healthy detox pathway genes, but still have a clogged liver for other reasons too. So you need to address those as a clinician. And the more you can do that, even regardless of whether a person's in, late stage 4, it's even more important to address those pathways. So yeah, if you can catch a person, when they're 14 years old and look at their genes and say, hey, you have these defects, you want to be more careful in this part of your lifestyle because of these defects, you might want to supplement these kind of nutrients because of these defects. You might be able to push out diseases that that person may or may not get diagnosed with, or eliminate that if you can be as proactive as possible.
So the patients that you're dealing with in your clinic, what's the proportion of people that are, gone down this conventional route, meaning that here's the chemo, here's the medication, and the people that are saying, yeah, I'll work with you at this level. I want to try what you're talking about. Is that the bulk of what's going on?
Well, most patients that seek us out have already gone down the conventional route, right, or are concurrently going down the conventional route. It just is the nature of the beast. When a person gets a diagnosis of cancer, it's a small percentage of people that are that proactive, that are like, boy, I just found out I have cancer. And they're thinking rationally and like, I'm going to go find out some alternative things to do. We do get some of those, and that's a joy to work with those people that haven't gotten a bunch of chemotherapy and such yet. But honestly, most of our patients are either in the middle of chemotherapy or radiation or surgery, or have done it and have failed that pathway, and then are seeking out alternative care. So the majority of our patients are stage 4 when they come to see us. Mm-hmm. That just happens to be our practice. And people are scared when they get a cancer diagnosis, and they tend to follow what their oncologist tells them to do. And many have great results, but some have regrets because of that, because they didn't slow down and take a look at things as closely as they wish they would have.
And you have this amazing reputation for these people coming to you after being failed by other methods, which are the sort of go-to conventional methods. And then you end up turning things around, whereas, what was meant to be the tool didn't work, again. And I think that comes back to, well, what is the purpose of the tool? It's to suppress that the last layer, the symptom, versus let's figure out what's going on.
Yeah, and the tool is damaging as well. So you're doing some radiation or chemotherapy, you're adding a whole lot of toxicants that you have to now detoxify. So if this person actually is suffering from cancer because of failure to detoxify or hyperexposure to some sort of toxin at some point in time, and now you're adding poisons to the body to kill the cancer, even if that successfully works, you do chemotherapy, it knocks the cancer down. It is so beneficial to concurrently do a natural approach to support those detoxification pathways to get rid of that chemotherapy, so it does less damage to your healthy cells, right, and you have less side effects of the chemotherapy.
And another unique perspective you have is you've understood the methylation system at a clinical level. Like you talk to most doctors and you'll hear he'll MTHFR, and that's the extent of the conversation. And MTHFR, good, bad, and let's figure out what that means, right? So there's a lot more going on in methylation than that. And how impactful has that been as in sort of a layer on the detox?
Well, that's important because a lot of doctors will do, a lot of functional doctors will do just testing on a few genes. Like they'll look at the MTHFR gene, and if there's more hits on that if you Google it than
Yeah.
anything else, because it's kind of a puddle deep understanding of genetics.
Right.
And oh, well, you have an MTHFR defect, and so we need to give you methyl groups. So they, without looking at the downstream effects of that, you can actually do more harm than good. Um, Even in a non-cancer patient, if that, if a person has a bunch of defects in their biopterin pathway and you're going to add a whole bunch of methyl groups to their combination, you can actually be stimulating excess serotonin and excess dopamine and cause rage issues and anger issues and a whole bunch of different problems that now you've just caused more problems by using supplementation because you don't have enough information that you're going on taking care of that patient. Now with cancer, it's a whole nother ball of wax because we don't, methyl groups, what do methyl groups do in our body? They help silence genes, and we don't want to be silencing tumor suppressor genes. So we are very careful in adding methyl groups to cancer patients. We want them to get methyl groups just solely through natural means by eating good foliage, and we give very little methyl groups supplementally.
So when the person comes to you, look, it keeps coming back to the liver health detox, taking that toxic insult load off of the cell so they can come back to life and flourish. What are the things that you're doing? What are the actual interventions? Is it supplementation? Is it more about diet? Or what are the recommendations people are getting?
It's both. I mean, you have to encompass a lifestyle change
Right.
so that that person, and in a way that that person can continue that lifestyle change. So you don't, we don't do diets like, every cancer patient goes on a ketogenic diet or something like that. This is not sustainable.
Mhm.
Secondly, it's not even correct. Ketogenic diet can be higher in animal proteins. It can be higher in dairy. Most cancer patients, dairy is a driver at some point, at some level. Stimulates IGF function, increases other growth hormones. There's other hormones in dairy that can be major drivers for cancer. So you do have to look at diet. We do supplementation and support detox pathways supplementally. But I talk a lot about what I call the 7 phases of detoxification, because elimination, phase 6, is a key. It's
Right.
quite often you get patients, especially if they're in a later stage cancer and using pain meds as well, that are constipated. If you're constipated, you're reabsorbing toxins. If you're constipated, you're not eliminating. And I mean, you're not getting toxins out of your body, even if your liver is doing the darndest job it can. It's just dumping it into the intestines, and your body's just reabsorbing it in the large intestine. So you have to start there, make sure you're eliminating. What I call phase 5 then is to bind, use some sort of binder of some sort, even if it's just dietary fiber, to help bind toxins in the gut so you're not reabsorbing, and just move back upstream that way. So there's physical things to do. We talk a lot about coffee enemas, really because the benefit of stimulating parasympathetic function. Your parasympathetics are that side of the autonomic nervous system that is your neurological control of all your detoxification processes, and of your immune system too. So when we're dealing with cancer, we need an uptick of their immune system as well as an uptick of their detoxification. And those are, from a neurological perspective, controlled completely by your parasympathetic side of the nervous system. And coffee enemas are one of the best ways to stimulate that. So even from doing hot packs over your liver or gallbladder, there's physical things that a person could do. There's nutritional things and dietary considerations as well.
And just from listening to you, well, first of all, to your point about elimination, I remember speaking to a clinician who deals with a lot of breast cancer patients, and she said the exact same thing. There's no point starting the detox if you're not eliminating and clearing, because where is it going? So you got to work on that first. Make sure that there's a flow. The end of the cycle actually exists. And
Yeah.
that's your detox, right? But going back to what you were saying, the way you look at cancer and the way you're describing it, and kind of the causality, it's not here's why we think maybe genetically you have this condition because your mama had it, but we're actually talking about like really why. It almost sounds like waiting to get sick and then come and seeing you as a third or fourth step because whatever else didn't work. You don't have to, you can actually start now. Like being sick shouldn't be the wake up call to start doing some of the things you're talking about, because we're talking about truly root cause, meaning that prevent it if you understand why it's happening.
Yeah, well, we have a very misguided understanding of healthcare in in the Western world. We wait till we do get sick and then we try to treat ourselves instead of trying to take care of ourselves so that we don't get sick.
Right.
And it's hard to change mindsets. And the entire medical profession is built upon that model. So they're not willing to try to change mindsets. So we're doing it at a grassroots level, trying to do that. Now, when we have cancer patients come to us and we go through a whole genetic profile with the cancer patient themselves, invariably the family members sitting and watching that Zoom call going over their genes are like, hey, how can I do this for myself and my kids? And well, yeah, that's a much wiser choice, really, to look at your body not just from a genetic perspective, but from a holistic perspective prior to getting sick, and you make better choices in life based upon that. Using a person's genes, it can be helpful because I used the term scared straight earlier. It can be beneficial to say, hey, you have this defect. You do not detoxify glyphosates very well at all. You need to be careful. This is the pathway that you make this, and you do have these defects. It doesn't mean that you don't make this very well, but you should support it this way. Think about, this dietary approach. Look at, you don't get rid of histamines very well. You have all these defects in your HNMT genes. Well, I don't have any problems. Well, you are presupposed to that. So maybe think about, doing this in your lifestyle. So you can point people in right directions, and it can give them information. I just think the more information that you have, you can be a better caretaker of your own health instead of relying on a doctor at all. Personally, I just don't like doctors. So I just think, so I try to, when we get information, we try to make videos and do blog posts and write books to get that information out there so people can be their best advocate in a world that is growing more and more leery of practice of medicine, and you need to be your own doctor, basically.
And when it comes to working with somebody like yourself, is there resistance? I understand. So I'm in Toronto, Canada, right? We have a very different healthcare system here. The problems are the same in terms of how we think about our health and the entitlement of, I'll just do what I want and the doctor will fix me. But the way we pay for it is different. Here, we have a government that pays for all our medical bills. So when it comes to people seeking out, help of the nature you're describing, how do they go about it? Is this them now having to go on their own because insurance won't help them, or what does that typically look like?
Yeah, I mean, we have been a non-insurance type practice for 20 years. So, yeah, the people do not utilize their insurance when they come to us. In America, at least, more and more people have, $5, $10, $15,000 deductibles, so they're used to paying for some
Right.
of their care. Now, to me, that's a beautiful thing to have such a great deductible. Less people are running to the doctor just to get antibiotics for their kids' ear infections that they shouldn't be doing. So people are allowing their immune system and trying to support their immune system to deal with viruses and bacteria and things. So I think that's a better way to go about. You're going to build your own antibodies instead of trying to wipe out your flora with an antibiotic. So there's a growing number of people that are seeing that the failures and the standards of medicine that are out there and are seeking out clinicians like us. We certainly never have a problem. We just, with finding patients, we have to turn patients away constantly.
Right.
And that's part of why we try to educate and put out blogs and videos and things and do interviews like this, because the more we can help people be able to help themselves, I think that is really the future, is using clinicians like myself and others that are out there as guides, but then you taking more of an active role in your own healthcare is really going to be where we're going to be at in the future.
So I mean, using that example of your child with the ear infection, I've been through that, by the way. And before I knew better, that's exactly what I did. I went and got the antibiotics because my mother, my kid's grandmother, yelled at me and said, "Why aren't you at the doctor yet?" Right? Because
Right.
that's what I think we're supposed to do. And again, this was a few years before we dove into this side of the world and learned this and started practicing this ourselves. So how does somebody in that position, what's that shift? What do they do? Because in that moment, first of all, what should they have done? I know what you're saying. If they had the proper immunity built up, maybe the infection wouldn't have happened, but it happened because it wasn't built up. So what alternatively should they have done? What are the habits they should start adopting? And that warning flag that your child has an ear infection, that should be the point. And the same context can be applied to yourself. You'll find yourself in the same position. What are those habits you can start adopting to take yourself away from, I know I'm in the wrong place now, to like, here's where I should be?
I think the first habit to adopt is start asking yourself better questions. And maybe one of the best questions to start asking is why. Always ask why. I mean, maybe you can't always come to the answer to that why. Like, why do I have strep? Why do I get a strep infection every winter? The answer might not be completely clear, but if the more you can understand simple physiology, the better. So start educating yourself. Start listening to webinars. Devour websites like ours and others, and read good books to teach you that, boy, every time I get a strep infection, the reason why I'm susceptible to it is I run and get antibiotics. Well, if you do that, you never allow your body to start making antibodies. So understanding simple physiology of an immune response. If I'm exposed to an infectious organism, I fire what's called a Th1 side of my immune system response to try to kill it. That's when I'll get a fever and not feel really well. If it can't kill it, that sickness progresses, and then my Th1 side suppresses a little bit. My Th2 side, the B cell side, fires, and that's what makes antibodies. Problem is, many people run to the doctor prior to that taking place, go get an antibiotic, which if it's a bacterial infection, it will knock down the infection. And now I feel better and I think I did the right thing. Well, you never allowed your body to go through that cycle of a Th2 reaction, a B cell reaction. That's what makes antibodies. So at the end of the game, after 2 weeks of having this, after initial exposure and having the infection, the strep infection, now I'm better and I'm back at work or school thinking that I've improved my immune system. But if I went down the pathway of getting an antibiotic, I really didn't improve my immune system at all. I actually hindered it. So the health of one's immune system, yes, it is, do I have a good, healthy white blood cell count? But the real health of one's immune system typically isn't measured through a standard blood test, because the health of one's immune system really quantified is how many circulating antibodies do I have against different pathogens.
Right.
So if I have circulating antibodies against strep and against different viruses and different bacteria, I am going to be less apt to ever, quote unquote, get sick, because when I'm exposed to that pathogen or a similar pathogen, that antibody tags it right away, and my immediate Th1 response prior to me ever feeling sick or getting a fever kills it, and I didn't get sick. Mm-hmm. But hey, Bob in my cubicle next to me had a horrible strep infection and I never got strep. I don't get strep. Why? Because you have circulated antibodies against strep. Therefore, your immune system killed it. So we need to just redefine um, the health of our immune system and support it wisely, and allow myself to be sick, kind of like great grandma did. What did she do when the kids were sick? They got chicken soup and laid in bed and allowed their body. Maybe she didn't understand physiology, but ignorantly she allowed that kid's body to fire a Th1 and a Th2 response, make antibodies. That child is now going to be less susceptible to similar pathogens because they have circulated antibodies against them, and you've actually improved that person's immune system. Now, I'm not so naive to think that the benefits of antibiotic therapy have saved millions of people's lives, but it's improper use of it that is ultimately hindering the growth and stealthfulness of a person's immune system. And we just need to be wise of that. So just understanding some simple concepts in physiology can be really beneficial.
The way you describe it is almost like exercising, just like you want to put on muscle, you got to break muscle. You got to go to the gym and rip it apart so it builds back
Yeah.
better again. Same thing.
Yeah.
You want to get smarter, go read books. You got to train it, right? So you can train your immune system to get stronger with exposure, right?
Yeah.
And not that you want to go run around and go suck up every virus from every tabletop, but that process of how often do you get sick, that's just exposure. But how sick you get, that's your measure of health. Meaning, can I actually cope? I do
Right.
have the antibodies, right?
Yeah.
And so, yeah, and that's very great advice, by the way, for anyone who's listening, because we're too quick to, and I understand when it's, especially when it's your children, I don't want to get too sick. I don't want their ear, to pop or whatever could happen, the eardrum. But for the most part, they're resilient, and you have to let them go through that exercise.
Yes, that's exactly right.
Yeah. So sorry. So going back to the cancers, I derailed you a little bit, but it just, your wisdom, we wanted to share it. The 5%, those genetic cancers, the ones that there's a direct cause, it's you're going to have it because of some gene variant. What you're suggesting in terms of the detox and liver health and less load on the cell, cellular health ultimately, is that also going to help that? Or are we saying that that's so direct causation that this doesn't matter?
Oh no. So let's say there's a direct causation. A person has Lynch syndrome and they,
Yeah.
they have multiple family members that had colorectal cancer and now they have colon cancer. Still, how you treat it is no different than if they didn't have Lynch syndrome. So you
Right.
still want to help detoxify their body. You still want to increase that person's immune system because ultimately it's your immune system's response directly on the cancer that's going to help that person overcome the cancer. So yes, so it wouldn't change the way you treat the person. That 5% that have cancer because directly from a genetic component, that is just a piece of the cause that you can't change. There's so many other factors that you can affect, and you want to address those. And you still got to get the body to fight that and get a direct immune response to that and stimulate the immune system, stimulate parasympathetics, all those things that go along with it.
Okay. And when you talk about toxins, so everything we've talked about up until now has been sort of external. Do you ever look at the internal, for example, oxidation or hormonal toxicity, like estrogen toxicity, and those levels and how they may cause an additional load?
Oh, for sure. So like oxidative stress, I mean, that is again, almost always caused by toxins,
Right.
oxidative load. So that's kind of on the same lines, but the hormonal piece is another piece. So, people think that so let's just talk about good and bad hormones. Well, they're all good. There's just certain metabolites of estrogen and progesterone that normally are not supposed to stay in the system very long. You're supposed to get rid of them through the detoxification pathways. And you do get rid of them the way you'll get rid of any poison. You're going to dump it into the colon via the bile, into the small intestine. It's going to go into the colon. And again, the problem is that we reabsorb those things. Estrogens are commonly reabsorbed in the lower descending colon. So if you can bind those with binders, make sure your intestinal transit time is correct, so you're not reabsorbing those things, the better off it's going to be. But it is these bad estrogens that can attach to certain receptors on cells. Typically, they're not the cause of cancer, though. So it's another thing to understand. Bad estrogens aren't getting inside the cell, interrupting the replication rate of cells, but they are blocking certain receptors on the outside of cancer cells, not allowing apoptosis.
Right.
So so it's important to get rid of those bad estrogens, but you still have to address other causes that is affecting the replication cycle, and you still have to follow back that stream and help with that detoxification of those, and look back at the pituitary and make sure you're not making excess estrogen, and or how you're exposed to exogenous estrogens, and there's a whole other discussion there too. So
you actually remind me of a family that we dealt with where the mother had breast cancer when she came to see us for the fourth time. And she was probably in her late 40s, I would say. And her son, by his 20s, I think he was in his early 20s, had testicular cancer. Okay. So they said, oh, it's genetic, without knowing, what that really means, but it sounds like it. Yeah, my son had what I had. And so we looked at her hormone pathways, and like you were talking about, that estrogen metabolite, right? You can produce 2-hydroxyestrogen 4 or 16, and that 16, that toxic stuff, is what the mother was producing. That was her net metabolite every month, and her son was doing the same thing. He inherited the same genetic legacy. Doesn't mean that they were born sick. It just meant that they produced this toxic metabolite every month from their hormone. For the male, it would be every day. For the mother, it was every month. That's causing, like you said, this toxic insult to the cellular structure. And then you think, well, the mother was also taking the birth control pill for like 10 years and adding even more estrogen fuel to the fire, right? Then you have to ask about estrogen mimics and chemicals and foods and what's that load. And that's why the thing that people think about isn't that consequential in terms of diet. Yeah, that could be the thing.
well, and the thing is, if you really did a study of 10,000 people, you'd find groups of people that have that same genetic makeup that are making excess 16-hydroxyestrogens and don't have cancer. Well, why is that?
Yeah.
Because they have other healthy detox pathways. They are getting rid of them.
Yeah.
And they have good elimination. They're not reabsorbing them. So you have to look at the body as a whole. And that's where the practice of medicine currently fails, is it separates it into systems and looks at it as just in little pieces. But your body doesn't function that way. Everything is dependent upon everything else. And you have this synergy that needs to be taking place, not just between cells, between organs, between systems. And when there's any failure there, it leads to problems elsewhere. So you need to take as high up stance and look at everything as possible from a physiological standpoint to really help somebody.
And it sounds like your answer to that, because as you said, you go to the conventional doctor, you're not going to get that sort of perspective, right? Because like you said, they're trained in the buckets. I do this, and I have blinders on. So this is what I do, and I do it really well. I've learned about it, but ask me about this or this, I don't know, right? So in order for the patient to sort of put themselves back in the middle, the answer to that, as you said, is learn. You have to go out there and download, read, webinar, educate, because you may not get beyond the blinder perspective from whoever you're dealing with.
Yeah, and I assume that anybody listening to this is in that category, that they want to do that. Otherwise, they wouldn't be listening to it. So hats off to them. But the more you can learn, the more knowledge you can gain, the more equipped that you're going to be able to make better health decisions for yourself, for sure.
And then you need that quarterback that can, because there's also the concern, you go read something, you find some information, somebody may stumble across on their own, oh, I need to understand my detox pathways, right? Then they may learn about some supplement, and then they may say, well, how's this going to affect my chemo How's this going to affect my radiation? And when they go ask the doctor, they said, do not take anything other than what we're giving you because it may affect it, right? So
Right.
really, you need that quarterback that has that knowledge set beyond your clinician who's giving you the chemo, which nobody's telling you not to do. It's just you need to supplement it with other things that are dealing with the root while you deal with that sort of acute problem.
Right. Exactly.
Yeah. So that's awesome. So I would ask you, I mean, everything you've said until now has been mind blowing and exactly, I think, what everybody was hoping to get from you. From the books you put out there, what would you say are sort of the top? I understand we keep going to detox and understanding that. What are the areas, top 2 or 3, that people are exposed to toxic insults that they don't even realize?
The well, probably the biggest toxic insult that we see as a causative issue with cancer is pesticides and herbicides.
Okay.
And it's people, even people like, goodness sakes, it can't be because I've been eating organic for the last 20 years. It's just, they're just everywhere now. It's just everywhere. Um, I've been tempted multiple times to bring, organic vegetables into my organic chemist friend just to test them. Just haven't had time to do that. But I would not be surprised if they're loaded with pesticides and herbicides, even organic fruits and vegetables. It's like, can we wash these off? Can we get rid of these? We just poisoned our world.
Yeah.
To the degree I don't know how it's going to be improved, but it definitely, consumer supply and demand drives things. So if people can just purposely start buying more organic thing, it's gonna drive the production of more organic things. So we tell people, regardless, you have to be supporting detox pathways, assuming that you're overwhelmed. Even if you don't know your genetics, you just need to do as many right things as possible. You're never going to be able to prevent all disease. You're never going to be able to prevent all cancers. You just try to do everything as well as you can without becoming too anxious about it, and you're going to have the best results. So,
And that sort of cognition, you leave your house and you now know that you take a step on a lawn, you go golfing, you go to a restaurant with a fancy garden, whatever it is. That's all the stuff that you're not meant to be breathing in, and it's as pretty and beautiful as it is, and it doesn't look like a threat. A lot of it is coming from there, and it's everywhere, right? And so it's even something as simple as a Teflon coated pan has estrogen mimics in it that you would never think are unhealthy. You're paying more; it's a more expensive pan, right? But it's causing you bigger problems. So it's starting to educate. If you do that one thing, learn what are these things that I'm surrounded by that I don't even know are slowly poisoning me, like you said.
right.
So yeah, and we had actually one last thought. You reminded me of a particular patient who had an extreme eczema issue, just wouldn't go away. And over and over again, they were going doctor to doctor, cream, steroids, whatever. They were doing all this stuff. And when we met them, when did this start? Because it was adulthood eczema. This started, I think it was in their 30s. We brought it back down to the date that they changed their mattress. And their mattress was completely laden in fire retardants and chemicals that were designed to protect them, right? And it was off gassing because it was in some plastic bag, and they opened it up, and all of a sudden they're breathing that stuff in for the first couple of weeks as it off gases, and then they continue to breathe in that memory foam chemical and the fire retardant on the fabric on top, and that was the thing that made them sick.
Yeah.
Right. So the answer
it's little things like that that most practitioners don't ever get a finger on, that people need to educate themselves. And I remember my daughter years ago, my wife called, she broke out in hives. She had hives all over her body. Well, I thought, oh, for sure, it's probably all the stuffed animals. She was the one that had, 40 stuffed animals on her bed. I tested with kinesiology, came home, tested none of those things, went in the bathroom. My wife had just purchased just one of those little round rugs in front of the sink. That's what the problem was. The whole treatment procedure for her was take the rug and throw it out in the garage. her hives went away. It's just chemicals that you can't see that are off-gassing that you're breathing in, that your immune system can react to, can cause a hyperhistamine reaction or worse, and give you just a world of problems because of it. So don't, you really kind of got to become a detective, really. Like,
Yeah, take control and work on it yourself. And this has been truly eye-opening, awesome. We're taking something that people believe is taken for granted. Like I'm getting, my mother had breast cancer, my aunt had it, it's in my genetics, and we're unpacking the answer to the question, well, why does it even happen? And now we're learning that you can actually control your destiny if you understood how to deal with the root cause, like throwing that rug in the garage, right? And that's essentially what you're saying about the cancer. Figure out what the rug is, right? Get rid of it. Figure out your capacity to deal with the rug at the genetic level, right? And that's awesome. And thank you for the amazing work you do. Thank you for joining us. This was truly eye-opening. Any last thoughts before we end?
No, thank you for all you're doing. If you want any more information about what we do, all my books are available on our website. We just encourage people to download them and read up and learn more about how to take care of yourself from as many different people as possible. So
Awesome. Thank you so much. It was a pleasure.
thank you much.